Good morning, everyone. My name is Linda Bird, and I'm a licensed clinical social worker here at Harrington Family Health Center. And as many of you know, we offer comprehensive and integrated services here for our families and with parents and children. We offer medical care, dental care, podiatry, and behavioral health care. And we're very excited this morning to introduce Barbara Koch of the Washington County Can Council. And so I'm going to introduce you, Barbara, and you please tell us a little bit about the groups you're going to be offering here.
So I'm Barbara Koch from the Washington County Can Council, and CAN actually stands for Child Abuse and Neglect. We're fortunate to be part of Sunrise Opportunities, and the director of this part of the program is Dixie Bodine, and our coordinator is Mandy Pepperman, and I am called the Can Council Educator, and we are partnering with Harrington Health Center to create parenting opportunities for families who have questions about being parents.
Okay, can you give us a little more information about the specific groups that you'll be offering that will be benefit to our parents and children here?
Sure, it is that we have a variety of groups. We would like to start with something that includes, that is parent-driven and parent-led, called the Circle of Parents. And that is an open-ended support situation where parents ask the questions, they dictate what the topics in each meeting are about, and we follow what they need. And then we also offer parenting connection classes like 1, 2, 3 Magic, which is a way of managing some unusual behaviors. And then we move on to active parenting and nurturing parenting. Those are different, more in-depth classes. We also offer co-parenting through separation and divorce. And we also offer nurturing parenting when you're recovering from alcohol or drugs. Mm-hmm. Those are some of the more intense programs we offer.
Typically, how large are the groups?
We find that most groups work best from 3 to 5 parents. Bigger depends. Smaller doesn't work at all. It's especially the parent led groups. They need to be pretty large in order for ideas to come across.
Okay. I know that often around in this area and probably elsewhere, there are barriers for some parents in terms of transportation or childcare or payment for services.
So we're fortunate because the Can Council comes under the Maine Children's Trust that we are able to provide not only the class for free, but we also provide childcare for free so parents can bring their children and have them watched for while they're in a parenting connection class. And then we bring something for folks to eat. We know that transportation is a huge barrier, especially in Washington County. We are working on that. We're trying to figure that one out, but we haven't quite got there yet.
Okay. And so a lot of our clients are struggling with tantrum type behaviors with their children, and how do you cope with that, and how do you have more effective skills to make your kids mind?
So each of the opportunities that we provide for parents kind of will focus on an age range. So we have active parenting, we have prenatal parenting, we have active parenting for the first 5 years, we have active parenting classes from 5 to 12-year-olds, which deals with different behaviors. They all are more focused on the age range of the child. So we would work with whatever the parents are interested in.
Okay. And do you have a proposed schedule for when this will begin and what will be offered, the timeline for the different classes? And is it pick and choose or?
Well, it's always pick and choose. How our plan is that we're planning on starting in July here on Thursdays, here in the Harrington Health Center on Thursdays. That's our day to be here. And we hope to open a circle of parents in the morning session, and then in the late afternoon, maybe evening sessions, work with more specific classes. And although July is our target date, if you find a need or if parents who are watching this are really interested and they contact us, we will try to put together a group that addresses their desires as soon as June. I don't think we could do it before June.
And what would be the process for signing up or registering if someone has an interest and would like to attend a group?
Well, because we're really lucky to have this collaboration with Harrington Health Center, parents can actually call here and would get referred, they could come and talk to you and would get referred to the CAN Council, or they can call me direct. And I'm going to tell you a phone number as soon as I remember it.
Okay.
So my phone number is 263-8293. And then the office number at Sunrise Opportunities is 255-4701. Either one of those numbers would get anybody who's interested to someone on the CAN Council. And we could then register them and find out what classes and start making a plan.
Okay, sounds great.
Yeah, I'm pretty excited. I'm really excited.
Now, how can we, myself and my colleague Jody Moncastle, how can we be supportive and work with you more fully in supporting our families?
Well, I think that a lot of times, especially if you're working with co-parenting or parenting after recovery from substance abuse, or any parenting, that it brings up other issues for families that are better dealt with professionals like you, that actually can work directly with direct issues that kind of stuff brings up.
Okay. Yeah, certainly I think that Jody and I already are working with a lot of parents, so my feeling about it is that we could just be extra support and reinforcement for whatever tools that you're teaching, and that we could just kind of be another resource for families.
Yeah, I think that it's a really good collaboration. I think that each group brings different strengths, and I think that for parents who are interested, I think they would find it worth their time. And it's like, I think I was telling you, I feel like what I do is like going to a warehouse. So if you have a job, you have to have specific tools. If you're a fisherman, you have specific tools. If you're a baker, you have specific tools. If you're a farmer, if you're, whatever your job is, those tools are the tools you get. And when you don't have what you need, you go get it. So parenting, which is a much more difficult job than any other job, I think, there is no warehouse or store to go to buy tools that see if they work. So what I think I'm going to offer is a variety of skills that parents can choose to use or not. And so all skills don't work for all parents, and all families aren't the same. So whatever works for that parent will be what they will leave with. And it's more around gaining information.
Ineffective parenting can really lower the stress levels in families and make cooperation better.
If you have a child who's screaming and tantruming all the time, or makes it difficult to go out, or makes it hard to get dinner on the table, or it makes it hard to do anything, talk on the phone, then you're a stressed parent. And the kids are stressed. And if you can bring those levels down, then everybody's happier. It's a win-win.
Thank you.
Well, thank you very much.
Very exciting.
Yeah, we're pretty excited.
And so thank you all for listening this morning. If you have any questions, please contact us here at Harrington Family Health Center or Barbara directly with the number she provided.
Opportunities. And we'll see if we'll have some information out here that we'll put on this page of contact information. I think we're going to do that.
Okay.
All right. Thanks.
Thank you. Good morning. Thank you. Thank
Thanks
you
a
all
lot.
again. Have a good day.